In this first segment, we will explain the sources of conflict specific to a healthcare environment and the two main categories of conflict, their relationship, and how they impact team cohesion. Conflict is an inevitable part of working in teams. Though individual team members share a common goal in improving outcomes for the patient, individuals have different backgrounds, values, may differ in opinions about patient treatment, or have interpersonal incompatibilities. These differences can lead to conflict. As we learned in Module 3, conflict can be a major barrier to team functioning. There are other characteristics of the healthcare environment that make it particularly vulnerable to conflict. Unclear or overlapping roles and responsibilities, hierarchical relationships, changing team membership, high stakes, stressful, fast-paced environment, unpredictability, lack of clarity about goals, and issues around accountability. Now let's turn to an example of a common conflict that one might see in a healthcare team. As you view this scenario, note the potential sources of conflict. Mr. Hart, a 59-year-old accountant, has been admitted to UCSF Medical Center for 5 days for bacterial endocarditis, which is an infection of the heart valve. He has a history of heart murmur and had a molar extracted about 3 weeks ago by his oral surgeon, Dr. Williams. The hospital team suspects that the bacteria from Mr. Hart's oral cavity entered his bloodstream at the time of his dental procedure, and then seeded his damaged heart valve, which is source of his long-standing heart murmur. After a brief stay in the ICU, Mr. Hart was transferred to the floor. Dr. Miller, the internal medicine doctor, rounded on Mr. Hart again this morning and determined that Mr. Hart is ready to be discharged. After some charting, she turns to Nurse Francisco Martinez.
Francisco, you can discharge Mr. Hart. He needs to stay on the same IV antibiotic regimen for 2 weeks to complete the course. I already put in his discharge papers.
Sure, I'll start his discharge paperwork now. Oh, he's been complaining about some throbbing mouth pain and refused breakfast this morning. His wife said that he was scheduled last week for a tooth extraction but missed the appointment because of his hospitalization.
That reminds me, I need to notify his dentist of this admission. I don't want to see him getting another infection. May I speak with Dr. Williams, please? This is Dr. Miller from UCSF Medical Center.
This is Dr. Williams. How can I help you this morning?
Dr. Williams, this is Dr. Miller, one of the internists at UCSF. I'm calling to tell you that I admitted your patient, Mr. Hart, to our hospital for bacterial endocarditis.
My goodness. That's why I missed his appointment last week. I hope he's okay.
He is doing very well. We are discharging him today. But Mr. Hart mentioned that he had a tooth extraction at your office last month. Did you administer prophylactic antibiotics prior to surgery?
I don't think so. Why?
Well, we believe that the bacteria was introduced into his system during the procedure and caused the infection. He became very ill 2 weeks later and was...
Wait a minute. Are you trying to say that I got him sick? I've been practicing here for nearly 30 years, and I've never been accused of harming a patient.
No, Dr. Williams, I'm just saying that a patient with a pre-existing heart condition...
What do you mean by pre-existing heart conditions?
Did you not know of Mr. Hart's history of endocarditis?
Endocarditis? He never mentioned that to me. Let me look at his chart. Okay, he says he did report a history of heart murmur, but denied ever being told by a physician that he needed antibiotics for dental treatment. His extraction was carried out according to AHA guidelines.
Oh, well, anytime you receive a new patient, don't you go over the past medical history thoroughly?
Mr. Hart is not a new patient. He's been with us for 3 years. And believe me, we know how to screen our patients.
Okay, so if you know everything already, I just want to remind you that if Mr. Hart needs another tooth extraction after this course of antibiotics, please make sure that he gets prophylactic antibiotics prior to the procedure.
Thanks for the concern. I have a very busy schedule here, Dr. Miller. Goodbye.
Unbelievable. No good deed goes unpunished. I'm just ordering some prophylactic antibiotics for Mr. Hart to take before his next tooth extraction. I can't trust that dentist with my patient, you know. Dr. Miller. Okay, I'm on my way. Francisco, please discharge Mr. Hart as soon as possible. I'm going to the ER to admit a stroke patient.
Let's review some potential sources of conflict. Dr. Miller is concerned and wants to make sure Mr. Hart gets antibiotic prophylaxis with his next dental extraction. There is also time pressure because she's admitting patients and is rushed because she knows that she will likely be called to an emergency department at any moment. Dr. Williams is offended and takes it personally that Dr. Miller is implying that Mr. Hart is ill from a procedure done in his office. He prides himself on the quality of care that he provides to all of his patients. He's also busy and has a full schedule of patients from the morning. In his prior experience, it is hard to get doctors to return his calls in a timely manner when he contacts them to check about antibiotic prophylaxis prior to the dental procedures. Experts divide conflict into two main types: task and relationship conflict. This is important because the impact of the conflict may be in part related to the type of conflict and how well it is managed. Task conflict occurs when there is a disagreement among team members about the content and/or the outcome of the task that is being performed. An example of a task conflict in healthcare would be disagreement among team members about which course of treatment is chosen for a patient. Task conflict might also include disagreement in the team around logistical issues about how a task should be accomplished. An example of this would be disagreement of how work should be divided among team members and which team member is responsible for which task. In this case, there's a task conflict about the use of antibiotic prophylaxis treatment prior to a dental procedure. Relationship conflict encompasses disagreement about personal issues that are outside of the task. An example of this would be personality differences between team members resulting in a conflict. Status, power, reputation, style, and recognition are contributing factors to relationship conflict. In this case, there's a relationship conflict as Dr. Williams feels offended by Dr. Miller's accusation regarding his professional competence. Experts agree that conflict handled poorly can have detrimental outcomes for the team's functioning and for patient care. Conflict may distract from the task on hand as team members spend more time and energy on resolving the conflict and less time on actual task performance. Additionally, conflict can impact members' satisfaction and commitment to the team and lead to increased team member turnover. Conflict can certainly increase one's stress and emotional exhaustion. Finally, there's been some patient safety data that suggests that team dysfunction, including dysfunction due to conflict, may increase the risk of errors and poor patient outcome, as well as lead to increased cost to the institution. Is conflict always negative? This is a question that's been subject of debate among organizational scholars and psychologists. Most scholars agree that relationship conflict negatively impacts teams and team functioning. However, some experts feel that task conflict that is well managed may have potential to actually improve outcomes. You can imagine if there's a conflict about the best way of accomplishing a task, members may have their views challenged, may hear other perspectives, and refine their thinking, leading to improved team decision-making and higher performance. If there is confusion about a task, conflict may need to lead to a better understanding of the task as members share information and better integrate the information about the task at hand. Think back to the case between Dr. Williams and Dr. Miller. By putting their heads together, they may come up with systems that enhance communication and collaboration between physicians and dental providers. Some research suggests that task conflict has the most potential to be beneficial when teams are faced with complex, non-routine tasks that may require creative solutions. However, many experts agree that the benefits of task conflict occur only up to a certain level of conflict, and after teams have passed this point of conflict can actually be detrimental. There are a number of potential barriers to effective conflict management, including lack of time or heavy workload, power differential, common fight or flight response to conflict, lack of recognition or motivation to address conflict, and fear of causing emotional distress in others. We'll talk more about strategies for effectively managing conflict in the upcoming segments, but some of the key individual traits for effectively managing conflict in interprofessional teams include open and direct communication, willingness to find solutions, showing respect, and practice of humility. Remember that conflict is normal and expected on interprofessional teams. In addition to a range of interpersonal differences, there are specific factors in healthcare environments that lead to conflict in teams. It's also important to remember that conflict, if handled effectively, has the potential to actually improve patient outcomes. If team members are open to hearing challenges, they may hear other perspectives and refine their thinking, leading to improved team decision-making and higher performance. If there's confusion about a task, for example, conflict may lead to a better understanding of the task as members share information and better integrate this information. Now for our forum discussion question. Think about a conflict you were involved in recently at school or in the workplace. What type of conflict was it? Task or relationship? Do you feel the conflict had any positive outcomes? We look forward in joining you in the forum discussion.